Hello, my name is Kyle Lawson. The world as we know it has done a huge turn. This pandemic has been a roller coaster of a time. In Ohio alone, at the time of this recording, upwards of 67,995 people have been diagnosed with COVID 19. 9,049 people have been hospitalized due to COVID 19, and 3,069 people have died as a result of COVID 19. Out of the number of people infected, 49% of those diagnosed with COVID 19 were male and 50% were female. The cases of infected people range in age from less than 1 year old to 109 years old, with the median age being 44. The statistics just mentioned are reflective of just over a 3 month period. This pandemic is also hitting close to my home, as I have had a cousin aged 21 and a great aunt aged 86 to be diagnosed with COVID 19 over the last 2 weeks. Since Ohio has reopened, the state has seen an increase in cases. The recent spike in cases, personally knowing some friends and family with COVID 19, makes me nervous, anxious, scared, and a little sad. Studies have shown that wearing a mask can help slow the spread of the virus. I want to first discuss results from a survey I conducted. I completed a phone survey to find out my audience's feelings about face coverings and the coronavirus. There were a total of 6 participants between the ages of 21 and 70. 3 participants were male and 3 participants were female. I asked the participants if they wore a mask in public, lived alone, regularly interacted with anyone over the age of 65, or with underlying health conditions, and lastly, I asked if the participants thought wearing a mask in public decreased the spread of COVID 19. The results were that 50% indicated they wear a mask in public, 33% indicated that they were not wear a mask in public, and 17% indicated to sometimes wearing a mask in public. 67% respondents indicated living with another person, and 33% indicated living alone. 83% of the respondents interact regularly with someone over the age of 65 or with an underlying medical condition. Results were tied at 50% where the respondents thought wearing a mask in public helps to reduce the spread of COVID 19. Now that we have an idea of audience perception, let's discuss the facts. Wearing a mask in public significantly reduces the spread of COVID 19. The COVID 19 virus is spread through viral droplets that come out of a person's mouth or nose when they cough, sneeze, or talk. Many people are asymptomatic, meaning they are infected but aren't showing any symptoms. Older adults and those with underlying health conditions are at increased risk of severe illness or death if they contract COVID 19. A young or healthy person may unknowingly become infected with COVID 19 and pass it to someone to whom they share a home or have regular contact with. The CDC recommends wearing a face mask when in public and when around people who don't live in your household. Also, face coverings help to prevent people who have COVID 19 from spreading the virus to others. Laboratory studies have shown that droplets generated when a person talks were blocked when their mouth was covered by a damp washcloth. Another study indicated that a person with a cold or the flu wearing a surgical mask significantly reduced the amount of those respiratory viruses emitted. Masks provide a barrier to keep droplets from spewing into the air. Here I have an example of this. I'm blowing into the candle, and as you can see, it's still lit. But now, no light. The mask mandates that have been put into place have led to a slowdown in COVID 19 cases. Masks filter and suppress air particles in which the virus can travel. Also, masks help with not touching your nose and mouth, which can increase the probability of becoming infected from something that was touched previously. There are some common myths about face coverings. A main misconception about wearing masks are wearing a mask for prolonged periods of time lead to CO2 intoxication. This is false. Studies have shown that wearing a mask for prolonged periods do not lead to any harmful levels of carbon dioxide intoxication or poisoning. Another myth is wearing a mask leads to reduced oxygen levels. This is also false because wearing a mask does not lead to reduced oxygen or an oxygen deficiency. They were designed to allow an ample amount of airflow while also being meshed enough to keep harmful particles out. Let's review statistics on how masks reduce transmission of COVID-19. A COVID-19 carrier without a mask has a high transmission probability of 75% to a healthy person without a mask. But a COVID-19 carrier with the mask has a 5% transmission probability to a healthy person with the mask. Also, a COVID-19 carrier with a mask has a very low transmission probability of 1.5% to a healthy person with the mask. Wearing a mask is one of the most effective ways to slow the spread of the coronavirus. In conclusion, masks are essential to reduce the spread of COVID-19. The number of COVID-19 cases are increasing in the states that have recently reopened after stay-at-home orders were put into place. When more people wear masks in public, fewer droplets go into the air and the risk of exposure decreases. This is a global pandemic within the United States, becoming the epicenter of the virus. Wearing a mask in public shows that you care about yourself and others. Please wear a mask, wash hands often, and practice social distancing. Wearing a mask can save your life, my life, or the life of a friend or a loved one. Thank you.